Hi, it's Nick Fogelson from Northwest Endometriosis and Pelvic Surgery. It's had a little funny thing to talk about on a little video here. I had a patient just recently come in because she's having some spotting, and she's had an IUD in for about 5 years, and she's been amenorrheic, which means she's not bleeding at all, but now she's starting to have some bleeding and was concerned about that. And there's a little, sometimes people don't really know, it's something worth talking about, is that the length of time that an IUD works on the package is really about how long it prevents pregnancy. So a Mirena IUD, which is one of the most popular IUDs, currently has an FDA indication for 8 years. A Paragard, which is a copper IUD, has an indication for 12 years. I think the Liletta, which is a kind of a copy of a Mirena, is like 6 or 8 years. These numbers are based on data that they presented to the FDA showing how long they prevent pregnancy. So they are about showing how effective they are at contraception. The reality is that they're contraceptive forever. If you put any foreign body in the uterus, it will be fairly effectively contraceptive. So in theory, an IUD will prevent pregnancy forever. The length of time that they have an approval is based on how long do they actually gather data and present that to the FDA. The general recommendation is that you swap out a Mirena at 6 or 8 years, depending on the packaging or depending on what country you're in and so forth. But so the issue with this patient is that she's starting to have bleeding, and she's only had the IUD in for 5 years. So the thing that's really important is that the effect of a progesterone IUD, which a Mirena is a progesterone IUD, the length is not about how long it will suppress menstrual cycles, because a progesterone IUD will often suppress a person from having menstrual cycles, and if they're having pain, it may reduce pelvic pain, uterine pain in some cases. So the length that it works is not necessarily the FDA-approved effectiveness of the IUD, because that's based on its effectiveness in preventing pregnancy. It's actually not uncommon that you'll place an IUD in someone and that it will suppress the menstrual cycle, and that somewhere between 3 and 6 years later, it sort of stops working and they start bleeding again. And I think that's because the IUD's progesterone is sort of wearing out. It has a reservoir of progesterone in there that is being slowly released, and that reservoir is eventually going to be depleted, and it's not producing enough progesterone to suppress menstruation anymore. And so if you have an IUD and you're happy with it and it is preventing menstruation and improving your pain, you may have to have it replaced after 3 or 4 years. You might have to have it replaced after 5 years. It depends on the kind of IUD too. Like the Skyla and the Kyleena IUDs are slightly smaller. They have less progesterone, so they're going to tend to stop being effective at preventing menstruation sooner. They might only last 2 or 3 years before you have to replace them. So it's just like an interesting thing to know about if you have an IUD, that we end up replacing them sooner. Now the good news is that your insurance will pay for a new IUD every year, and so even if it has a 6-year lifespan or an 8-year lifespan, if you need a new one after 2 years, that's generally not going to be a problem. Generally, it's going to be covered by your insurance plan. So something to think about. IUDs are they're a highly effective way to prevent pregnancy. They are a way to suppress menstrual cycles in people that have pelvic pain. They can be helpful in people that have really heavy bleeding from fibroids or from adenomyosis. They can also tend to reduce the severity and amount of bleeding that people have. So they're all often a good option. And people that have endometriosis who want to suppress bleeding and suppress pain, they can be a good option too. They're not going to remove endo, but they probably will have some progesterone effect on the endometriosis. So that's an option for suppression either before or after surgery. So interesting thing to think about. If you have any further questions about IUDs, shoot it in the comments and I'll try to answer.